What if your heart was slowly drowning your body in its own fluids? Swollen legs, constant fatigue, and breathlessness? These are not just random symptoms. They could be the silent warning signs of right-sided heart failure. Introduction to right-sided heart failure. Right-sided heart failure is a serious medical condition where the right ventricle of the heart loses its ability to pump blood efficiently into the lungs. Normally, the right side of the heart collects oxygen, poured blood from the body, and pushes it toward the lungs to receive oxygen. However, in right-sided heart failure, this pumping action becomes weak. As a result, blood begins to back up in the veins, causing swelling in different parts of the body. Unlike left-sided heart failure, which primarily affects the lungs, right-sided heart failure creates problems in the body's circulation. Commonly, it is not an isolated condition, but rather a consequence of left-sided heart failure. When the left side of the heart fails, it increases pressure in the lungs, which then makes the right ventricle work harder, eventually leading to failure. This condition is particularly concerning because it affects vital organs like the liver and kidneys due to poor circulation and fluid retention. Understanding right-sided heart failure is essential for both prevention and early detection, as untreated cases can severely impact quality of life. Education, lifestyle changes, and timely medical care can significantly reduce the burden of this disease. To causes and risk factors, there are several underlying causes and risk factors that contribute to right-sided heart failure. One of the most common causes is left-sided heart failure, where the failure of the left ventricle increases pressure in the lungs, putting extra stress on the right ventricle. Another major cause is chronic lung disease, such as chronic obstructive pulmonary disease (COPD) or pulmonary hypertension, which forces the right ventricle to pump harder against high lung pressures. Heart valve diseases, particularly tricuspid and pulmonary valve disorders, can also weaken the right side of the heart. Risk factors such as high blood pressure, coronary artery disease, obesity, diabetes, and long-term smoking further increase the chances of developing this condition. Additionally, excessive alcohol use, drug abuse, and untreated sleep apnea can worsen heart function and trigger right-sided heart failure. Genetic predisposition and aging are also significant contributors, as older individuals are more likely to suffer from heart-related illnesses. Identifying these causes and risk factors early plays a critical role in prevention. By controlling blood pressure, avoiding smoking, and managing chronic diseases, people can lower their risk of developing right-sided heart failure and maintain a healthier cardiovascular system. 2. Symptoms of right-sided heart failure. Right-sided heart failure presents with distinct symptoms that are often related to fluid buildup in the body. One of the most visible signs is swelling, also known as edema, which usually starts in the feet, ankles, and legs but can spread to the abdomen. Patients may experience weight gain due to fluid retention, even without increased food intake. Another common symptom is swelling of the veins in the neck, called jugular venous distension, which indicates blood is backing up in the veins. Fatigue and weakness are frequent complaints because the heart cannot supply enough oxygen, rich blood to the tissues. People with this condition may also have an enlarged liver or spleen, which can cause abdominal discomfort. Difficulty breathing is another important symptom, especially during physical activity or while lying down, although it is usually less pronounced than in left-sided heart failure. Loss of appetite and nausea may also occur because of pressure on the digestive organs. These symptoms may worsen gradually or appear suddenly, depending on the severity of the disease. Recognizing these warning signs early and seeking medical attention can prevent further complications and improve long-term outcomes for patients. 2. Diagnosis and treatment. Diagnosing right-sided heart failure requires a combination of medical history, physical examination, and diagnostic tests. Doctors usually start by checking for visible symptoms such as swelling, fatigue, and jugular venous distension. Blood tests, chest X-rays, and electrocardiograms (ECG) are commonly used to assess heart function. Echocardiography is particularly useful because it shows the pumping efficiency of the heart chambers. In some cases, cardiac catheterization may be performed to measure pressures in the heart and lungs. Once diagnosed, treatment focuses on improving heart function and reducing symptoms. Medications like diuretics help reduce fluid buildup, while ACE inhibitors, beta blockers, and vasodilators improve overall heart efficiency. In severe cases, surgery may be required to repair or replace faulty valves, or even implant mechanical devices to support heart function. Lifestyle changes are equally important. Patients are advised to reduce salt intake, limit fluid consumption, quit smoking, and maintain a healthy weight. Regular exercise under medical supervision can also improve cardiovascular strength. Early diagnosis and proper treatment significantly improve survival rates and quality of life, preventing the progression of right-sided heart failure into a more life-threatening condition. 2. Prevention and long-term outlook. Preventing right-sided heart failure involves adopting a heart-healthy lifestyle and managing existing health conditions. Since many cases develop as a result of left-sided heart failure or chronic lung disease, treating these underlying conditions early is crucial. Regular medical check-ups, controlling blood pressure, and managing cholesterol and diabetes can greatly reduce risk. A balanced diet low in salt and saturated fats along with regular exercise strengthens the heart and improves circulation. Avoiding smoking, excessive alcohol, and drug use is also vital for long-term heart health. For individuals already diagnosed, strict adherence to prescribed medications and lifestyle changes can slow disease progression and improve daily living. Patient education and support from family members play a major role in managing symptoms effectively. With proper treatment, many people with right-sided heart failure can live fulfilling lives, though regular monitoring is essential. However, if left untreated, the condition can lead to severe complications such as organ failure and even death. Therefore, prevention, early detection, and consistent management are the keys to ensuring a better long-term outlook for patients suffering from right-sided heart failure.